Welcome, everyone. Good evening. Welcome to the 8th in the series of PSR's Clean Energy webinars. These webinars have been instrumental in training and empowering our Climate Health Action Team members, as well as all PSR members, to advocate for a health and protective energy system, one that's based on energy efficiency and sustainable energy such as wind and solar rather than coal or more natural gas. My name is Paz Ardasa Regan. I'm the climate organizer at Physicians for Social Responsibility. Tonight, the other staff on the webinar from PSR are Barb Gottlieb, our Director of Environment and Health, and PSR's Executive Director, Catherine Thomason. Barb will be presenting the targeted action for August, and Catherine will join us towards the end of the webinar to invite you to some exciting September events. Also assisting us tonight is Julia Morgan, PSR's webmaster. The webinar is being recorded, and it will be up on the PSR website sometime tomorrow. Some little important information for you tonight, a little housekeeping, if you will. We will be taking questions after our guest speaker has finished presenting. I invite you to ask questions in two different ways. Look at your sidebar, and you'll see a box that says questions. You can type your questions in the box, and during the question and answer time, I will read them out. Or you can raise your hand by going to the little side area here where there's a hand icon. You can click on it. During the time of question and answers, I will unmute you, and then you will be able to ask your question. Do remember, though, that to use that feature, you do need to either be on the phone or have a microphone-ready computer. Tonight's webinar is on effective and positive climate health communications and messaging. Before we get started, let me go quickly over the action item from last webinar, the July webinar. During that webinar, we asked you to send letters to your governor to urge them to support the Clean Power Plan in your state. Over 1,633 people sent letters to their governor, and we thank you for that. Tonight, we are excited and honored to welcome Edward Maibach as our featured speaker. Ed is a university professor at George Mason University and the director of Mason Center for Climate Change Communication. His research, which is funded by the National Science Foundation, NASA, and private foundations, focuses on public engagement in climate change. Ed recently co-chaired the Engagement and Communication Working Group for the 3rd National Climate Assessment and previously served as Associate Director of the National Cancer Institute, Worldwide Director of Social Marketing at Porter Novelli, and Chairman of the Board for KidSave International. Ed earned his PhD in Communication Science at Stanford and his Master's in Public Health at San Diego State University. When we approached Ed almost very last minute to ask him to do this, he graciously accepted. And I think everyone on staff jumped up and down because we thought we had scored probably the best expert on communications messaging around climate change. So welcome, Ed. And at this time, we'll be showing your screen from your desktop so that you can get started.
Thank you, Paz. Are you seeing my screen?
We are seeing your screen, and we're seeing it large. You're fine.
Fantastic. Well, I'm jumping up and down, too, let me say, because the thought of last month's webinar generating 16,000 letters to governors across America, that is absolutely phenomenal. So congratulations to all of you for that accomplishment. Let's see if we can't one-up tonight. I'm going to be taking about 20-25 minutes to run you through very quickly a couple of key ideas about how to communicate effectively about the link between climate change and health. The most important thing, perhaps, that I will say is my own guiding principle for how to spread ideas. It's a very crowded communication environment out there, and when we are all saying different things, Even if they are all fabulous things, we tend to end up canceling each other out, which is why it's so incredibly important for the effectiveness of communication initiatives that we articulate simple, clear messages. We do so in a manner that they get repeated often, and we not only use our own trusted voices to convey those simple, clear messages, but we encourage and enable other trusted voices to reinforce our messages. So this really is the guiding principle for everything that I do and everything that I will say tonight. Let me just say a little bit more about what I mean by simple, clear messages. It is an absolute communication truism that the less we say, the more we're heard. It's just the way the human mind works. We're able to pick out one thing. We're not nearly as able to pick out and remember 3 things. And by the time we get past 7, there's absolutely no chance that anybody will remember. So it's a paradox, but it is nevertheless true. The less we say, the more we are heard. Therefore, it's incredibly important that we figure out what are the things that have the most value to say, the things that will specifically help us achieve our communication objective. And there is no better asset than audience research to help us determine which messages will have the most value. I don't expect any of you to be engaged in the audience research, but fortunately for you, that is my day job. This is what I have spent the past 8 years trying to figure out what Americans understand about climate change. Not exclusively climate change and health, but I did, in fact, as I am a public health professional by training, that is what I began my studies on, and recently over the past year I've returned to that. Because there is a lot that we have learned, and I'll try to share some of that with you. So what is it that the audience research is telling us? Well, we know that most Americans see climate change as a distant problem. It's distant in space, meaning it's somewhere else, it's not here. It's distant in time, meaning sometime in the future, not now. And it's seen as distant in terms of species. It's affecting perhaps plants, penguins, and polar bears, but most Americans don't see it as affecting people. So each of those are systematic distortions in the way the average American understands climate change. Similarly, the average American sees climate change as an environmental problem and or a scientific problem, possibly even a political problem, but as I've already intimated, much less so a people problem. So another way of thinking about that is that climate change has been primarily framed as an environmental problem and a scientific problem, not really as a human problem or a public health problem. And I would contend, although I wrote on this slide that we have a framing problem, actually I would contend that we have a framing opportunity, and that's what we're going to talk about tonight. And then the third and final thing that I wanted to point out about what the research has taught us is that most Americans are completely unable, top of mind, to name a single way in which climate change is bad for human health, or to identify a single group of people who are at risk of being harmed by climate change. So these are 3 really important top-line findings, which all, to me, indicate that the American public is fundamentally not grasping the fact that climate change threatens people too. It's bad for our health. So this is the dominant way in which the public sees it. It's a plants, penguins, and polar bears problem. It's a science problem. It's a political problem. The problem with all 3 of those frames is that none of them are very engaging. Many Americans are, in fact, engaged as environmentalists, but most Americans aren't. Our opportunity, those of us here tonight on the webinar and all of our colleagues in the health community, our opportunity is to reframe the issue of climate change as a human health problem, a people problem. Because while relatively few Americans care deeply about environmental issues, all Americans care deeply about our health and the health of our children, our parents, our siblings, etc. There is no such thing as the public. While I will talk tonight a bit in generalities about what the public thinks, it's really important to recognize that, well, there is no such thing as the public. In our research, we've identified 6 distinct publics. We call them Global Warming 6 Americas. They fall along a continuum from on the left-hand side of the slide, the group that we call the alarmed, a group that is pretty much completely on board, understanding that climate change is happening, it's human caused, it's a serious threat. Many of these people actually do understand that it's harming human health. But you'll see from the size of the bubble, the 13%, they're a relatively small group of Americans. On the other side of this slide, the equal and opposite public from the alarmed are a group we call the dismissive. They are also 13% currently, give or take, of the public. They are the alter ego of the alarmed in the sense that they feel very strongly about the issue, every bit as strongly as the alarmed, but they've reached the opposite conclusion. They don't believe the climate is changing, and if it is changing, they certainly don't believe it's human-caused. They're not the least bit worried about it, and they think that any expenditure of public resources to address it would be a travesty. The factors that differentiate which Americans fall into which of those 6 groups, there are what we call the big 5 key beliefs. These aren't the only factors that determine where a person falls on that continuum from alarm to dismissive, but these are the 5 that I want to draw your attention to tonight, because these are 5 key beliefs that our research has shown are there's a real need to influence them. As I'll show you in a moment, most Americans don't hold these key beliefs. And what's most important, you'll see on the right-hand side of this slide, people who hold these 5 key beliefs, or to the extent that people hold these key beliefs, they are more likely to support a societal response to climate change. They are more likely to support a range of specific proposed climate policies, and they are more likely to personally be rolling up their sleeves to get involved either as in a political capacity or in their capacity as consumers. In other words, they're more likely to be involved in political and consumer activism. These 5 key beliefs are pretty simple. They're very fundamental, simple ideas. Climate change is real. It's human-caused. It's harmful to people, it's solvable, and that experts agree that human-caused climate change is happening. The reason why the experts agree is off to the left is because our research has actually shown that it is the most fundamental belief of all. People who understand that there's an expert consensus on human-caused climate change are more likely to believe that climate change is real, human-caused, harmful, and solvable, and in turn they're more likely to be involved in bringing about a response. So let me just show you where we are currently in terms of those 5 key beliefs. The light blue line on top, this is people who tell us that in response to our question, do you think global warming is happening? They're the ones who say yes. Currently, on the right-hand side of the slide, you'll see that almost 2 out of 3 Americans, adults, are saying yes, they think global warming is happening. But in terms of those who think it's happening, we ask them, how sure are you that it is happening? Extremely sure, very sure, moderately sure, or not at all sure. And you'll see that only about 1/3 of Americans tell us they're extremely or very sure that global warming is happening. So while 2/3 believe it's happening, only 1/3 are certain of their beliefs, which means got a lot of people with some fairly shallow beliefs out there about this issue. We follow up with the question, assuming global warming is happening, do you think it's mostly caused by human activities? And that is the light blue line on top. You'll see that we drop down to about half of Americans believe that climate change is happening and it is mostly caused by human activities. So that's a fairly profound disconnect with the reality that, in fact, won't go into this, but it's more over the past 50 years, more than 100% of the warming over the past 50 years is caused by human activities. Now, that most fundamental beliefs that I spoke about a moment ago, which we call perceived scientific consensus, this is one where there's the biggest disconnect. So in this particular iteration of the question, we ask people, to the best of your knowledge, what percentage of climate scientists think human-caused global warming is happening? And then we give them a slider bar. We allow them to answer anywhere from 0% to 100%. This slide shows the summarization of the data, but I'm not sure if you can see my cursor or not, but I'm pointing to the light blue bar the rightmost light blue bar, that's people who say between 91 and 100% of climate scientists think human-caused climate change is happening. That would be the right answer. The right answer is actually more than 97%, but only 9% of Americans get even close. You can see that the largest single response is people who tell us they don't know. That's 30% of our respondents. So again, a real fundamental disconnect in this most basic of all beliefs about climate change, that most Americans think there's a fair amount of disagreement among the experts. My fifth of the big five, that climate change is harmful to people. We ascertain people's beliefs about this in a variety of ways. This particular graph is showing the responses to the question, when do you think global warming will start to harm people? And you can see that only a third of Americans think people in America are being harmed now. As you move across the Six Americas continuum from the alarmed to the dismissive, each category sees human harm is happening further and further into the future. So 25 years out, 50 years out, 75 years out, 100 years out, and then the dismissive group don't believe people will ever be harmed. This slide is a little busy, but I'm going to show you what I want you to look at. So this is the slide that represents people's views of the solvability of global warming. We ask people which of the following statements comes closest to your view. The statement on the data on the very bottom in the black line, humans can reduce global warming and we are going to do so successfully. That is clearly the belief I would like every American to hold, but as you can see, only 6% of American adults currently hold that belief. Conversely, if you go to the top of the slide, the medium blue data, that is the response: humans could reduce global warming, but it's unclear at this point whether we will do what's necessary. That's probably actually the most realistic answer, and you'll see that most Americans, in fact, that is the modal response. From the perspective of engaging advocates to roll up their sleeves and get involved, this is not the most helpful of belief systems. So what I'm going to suggest to you now is that in order for us as health professionals to positively help shape the big five beliefs, we don't actually have to speak to all five. So instead, what I've articulated for you on this slide is what I call the key three messages for health professionals. The first of those key three messages enables you to essentially not address the reality of climate change and the human causality driving our changing climate. And the reason why I want to encourage you not to engage in that is because unless you've spent a lot of time studying climate science, you might not feel confident yourself in your ability to make that case, that climate change is real and it's human caused. Conversely, you'll see that the first sort of the core message that I've included in my key three is the scientific consensus message. More than 97% of climate scientists are convinced that human-caused climate change is happening. That message was not written casually. As a matter of fact, those specific words are the product of enormous amount of research by myself and my team. That statement, when read one time, moves the average American's belief about the scientific consensus from about 60%. They estimate there's 60% of climate scientists think human-caused climate change is happening. After reading or hearing that statement one time, on average, they move their estimate up to 80%. In some ways in which we've used it, they move up to 90%. So this is a very powerful message. It's a very useful message for health professionals because they don't, I personally, as a public health professional, I would rather say it isn't my job to convince you that human-caused climate change is happening, but what I would like to tell you is that more than 97% of climate scientists are now convinced that human-caused climate change is happening. And my job as a public health professional is to figure out if, since that is true, what do we need to do about it? What is the consequence for our health, and what can we do to protect our health? Which takes us to our second message. And that message is that polluted air, polluted water, and climate change are hurting our health badly. and it's going to get much worse if we don't take actions to protect ourselves. Again, that message is not casually written or suggested either. That is a message that has been tested by a variety of research teams. The concept of protecting our health is particularly strong. So the first part of that message is simply introducing the frame that climate change is hurting our health. The second part of that message is that we need to take actions to protect ourselves. And then the third and final message is that every American, all of us, every family, every community, every business, every state, as well as our nation as a whole, can take steps that will protect our health and our climate. And that while there are many steps we can take, the two most important steps that we must take to protect our health are to reduce energy waste and to use or to support the use of clean energy, moving away from dirty energy and pivoting towards clean energy. These are messages that I'm absolutely certain will help in terms of engaging the public. Our research has shown that people are interested in this information when we give it to them, but I actually want to walk you through a slightly different permutation of these three key messages. I don't know if any of you are familiar with the concept of a message box, but any of us who've been trained to interact with the news media, if we've received media training, you've undoubtedly encountered the notion of a message box. It's simply a way of identifying what your key messages are and organizing them so that you can commit them to memory and bring them back into your conversation, whether you're on live television or whether you're simply talking to somebody at the dinner table, somebody who you would like to help them better understand how climate change influences our health. So the way a message box is organized is there's a message about the problem, there's a message of why that problem is relevant to you, the listener, there's a message about the solutions, and there's a message about the benefits that we will enjoy if we enact the solutions. And all of that is sort of framed up in the context of that middle box, which is the issue. So the way I have organized those three messages that I gave you earlier into a message box is, you see it here. It's a little bit more detailed, but really not a lot. So I frame up the issue in this case because I just wanted to share my thoughts about how to talk about climate change and health. I frame up the issue as the fact that our nation's leading climate scientists have concluded that climate change is already harming people in every region of the country. I'll talk more about the National Climate Assessment findings on health later, but this really is a reference to that chapter in the third National Climate Assessment, which was released in May of last year. And then the other sort of large issue point that I want all of you to keep in mind is this way of pivoting into it as a health professional without getting dragged into having to defend the science. And that was my scientific consensus statement, the more than 97% of climate scientists. So now pivoting to the kind of messaging that you, or information that you uniquely as health professionals can introduce. That the problem is that dirty fuels are polluting our air and our water, and they're dangerously destabilizing our climate. By the way, the phrase dirty fuels and the phrase polluting our air and our water, those are words that I've drawn directly from audience research. In my time spent interviewing people about what they understand about climate and health, this is the way that they talk about the way in which we fuel our society is a bad idea. It's bad for our health, and even if they don't really understand anything about climate change, they do understand that dirty fuel pollutes our air and our water and is bad for our health. So the so what of that problem is that air pollution, water pollution, and climate change are harming our health now in a variety of ways: asthma, lung and heart disease, heat waves, violent storms, wildfires, infectious diseases, and more. And it will worsen if we don't take effective steps to protect ourselves. So what are the solutions? Well, there are many solutions, the two most important of which are we need to stop needlessly wasting energy, and we need to replace dirty fuels, especially coal, with clean renewable fuels like solar, wind, and geothermal. And it's important to understand that everyone can participate in this. Every family, every community, every business, and every state. And then from there, we can pivot to the benefits, that the sooner we take these steps to protect ourselves, the sooner every American family will benefit from cleaner air and water, better health, lower healthcare costs, and truly stronger communities. That takes a little bit to explain in what ways our communities become stronger, but we can talk about that later if you like. So protecting ourselves from health effects of climate change is not only the right thing to do, it's the smart thing to do. So that's really it in terms of what I see as the core of the public health message about climate and health. Let's talk very briefly about how I'm recommending that you communicate these messages. First and foremost, be yourself as a health professional. You are a valued, trusted member of your society, and so be yourself as a health professional, but also feel free to express your concerns as your hopes as a person. We are all we are all people in addition to being health professionals, and it's okay to break role as a health professional to talk about your concerns and your aspirations as a parent, for example. In our surveys, we've ascertained how much health professionals are trusted. This particular slide simply shows people's responses to the general question, how much do you trust or distrust the following as a source of information about global warming? You can see the CDC, for example, is trusted by 66% of the public. 53% say they trust their primary care doctor. When we ask a more specific question about who do you trust as a source of health information about the health effects of global warming, people's primary care doctor pops up to the top of the list. So you are trusted. Second recommendation, show appropriate concern and a sense of urgency by all means, but always remain optimistic. There is nothing quite as repellent as despair. Hope and optimism is attractive. It brings people in. They listen, where despair repels people. So it is easy for those of us who understand what desperate times we are really in to show despair, but as a communicator, you don't ever want to do it because it's counterproductive. Be clear that there is a range of actors who should be taking action. It's not only individuals, and it's not only government officials, but it's businesses as well. It's community groups. The more we invoke the range of actors that can and should be taking action, the more that squares with the public's understanding of what they would like to see done. So this data simply shows our people's responses to the question, do you think each of the following should be doing more or less to address global warming? You can see that at the top of the slide, the number one actor that the average American wants to see doing more is corporations and industry. Number two is citizens themselves. Number three is the U.S. Congress and their member of Congress. Number five is people's local government officials and their governor. And only finally, at the very bottom, do we have the president. So to me, this means most Americans would like to see action on the part of a wide range of actors. I think it's really important that you reiterate that when you talk about what can be done. The next point is that when you can, you want to emphasize specific actions that each actor can take to reduce energy waste and to move towards clean energy. This just happens to be a screen capture from Pepco, my energy provider at home, and I liked it because I liked the fact that they divided it into what you can do at home, what you can do in your business, and what can happen in your community. I don't really want to get into any specifics, but I just liked their illustration of my point. Show different actors what each of them can do. It's also very helpful, especially given the fact that hopefully all of us will be participating in shaping our state's response to the Clean Energy Plan. So it's very helpful to know how much dirty energy we're currently using in our state. And this absolutely incredible graphic that was developed by the Washington Post is a great asset that I encourage you all to look at. So the web domain, the web address is at the bottom of the slide. I do believe you'll have access to all of these slides to capture that web address later, but I just illustrate here with Virginia because that is where I work. And so you can see in Virginia that of our top 5 sources of energy, currently only number 5 is a renewable energy, hydroelectric. You don't see wind on here yet. You don't see solar breaking through into our little radar screen, but it certainly dimensionalizes how much opportunity we have in Virginia to mount a really exciting state power plant. And then this is, again, I just put this up as another reference for you. The U.S. Department of Energy has a wonderful website, the Green Power Network, that will help people in any state of the union identify exactly where they can buy green power in their state. And I think that's really important, because that is one way in which every one of these actors can begin to pivot away from dirty energy and towards clean energy, and that is by purchasing clean energy. So the next way in which I encourage you to communicate the message is by simply being confident in what you're saying. Many people who are just now beginning to engage in the public dialogue about climate change, they have an inordinate fear that they will get their head lopped off by angry people out there in the audience. And it really isn't so. So the Six Americas figures that I showed you earlier, yes, it's true that 13% of Americans are fairly angry about thinking that climate change isn't real, but it's only 13%. The other 87% of Americans will be very interested in what you have to say. We've tested a lot of these messages, and we find that pretty much across the board, even the dismissive Americans are interested in the health effects of dirty energy and of climate change. Sorry, let's skip past that. So I want you to, if you haven't already, I want you to spend a little bit of your time over the next week looking at the health chapter in the National Climate Assessment. It's very short, it's very concise, it's very on point in terms of laying out the health impacts in the U.S. currently, what they could become going forward if we don't take action to protect ourselves, and it also elaborates very nicely and very concisely different actions that we can take to protect ourselves. So to the point I was making before that most Americans support your goals, this is actually the current level of support for America. We don't mention the Clean Power Plan by name, but we describe it in the question. We say, how much do you support or oppose the following policy? Setting strict carbon dioxide emission limits on existing coal-fired power plants to reduce global warming and improve public health. Power plants would have to reduce their emissions and or invest in renewable energy and energy efficiency. The cost of electricity to consumers and companies would likely increase. We think that is a very fair, plain language description of the Clean Power Plan. And we ask people how much do they support or oppose it. And as you can see, a really strong majority of Americans support it. A minority oppose it, but that minority is only about 30%. So it means that at least 6 out of 10 Americans, when you talk to them about your state, for example, about your state creating its state power plan to be in compliance with the Clean Power Plan, they're with you. They think this is a good idea. And just yet one more piece of data. We've been asking since 2008 how much people think this should, addressing global warming and developing more sources of clean energy should be a priority for the President and Congress. And every time I get depressed at all, I look at this slide because I find this slide to be so cheering. The fact that 86% of Americans currently think that it should be a medium, high, or very high priority for the President and Congress to be developing clean energy sources. I think that's a really, really cheerful fact and one that gives me great heart when I engage in public dialogue on this issue. So my seventh and final, I swear, my final request or suggestion to you in terms of communicating the message is that I ask you that you come to my website and download this kit. It's a primer, not a kit. Actually, it's a communication primer that my colleagues Matt Nisbet and Mindy Weathers and I designed about 5 years ago. It's not the most current thing you will find, but I still stand by it as having value. I've spoken with deans of schools of public health recently who say they think it has value, and they continue to have their faculty use this and teach this kit to their students. So I like that a lot. It gives you a lot more recommendations about different ways in which you can engage in the public dialogue than I've been able to give you tonight. And when you come to my website to download that kit, I ask that you, on the home page, I ask that you join my listserv by clicking down there in the bottom right, so that you can receive our research as soon as it is, as soon as we release it. We are not very good academics in that we place a priority over getting our actionable information into the hands of people who can use it. We place that over as a higher priority than publishing in the academic literature, which we do eventually get around to. But our top priority is giving people like yourselves actionable data and suggestions. So when you come to my website to download the communication primer, please give me your email address, and you will become one of my 3,500 people around America who are receiving our information. So that's it. I now can take a breath and to hear your questions, your suggestions, and your observations.
Thank you so much, Ed. This has been so helpful, so informative, and you were able to do it all within the time allotted. We're going to move now into the question and answer period. There are two ways, again, that you can do this. You can either click on the little hand icon. If you have a telephone or a microphone, then you can speak. I'll unmute you. If not, there is a box that says questions, and you can type your question there, and I will ask for you. At the moment, I do have one person that had their hand raised, and that is Donna Murphy. Donna, I am going to go ahead and unmute you. So within about 10 seconds, you may be able to ask your question. Donna, are you able to hear us, and can you speak now so we can hear you? Donna Murphy, you have been unmuted. Okay. Donna, I will come back to you. I will read one of the questions for now, and perhaps in a couple of minutes you'll be able to speak. There is one question here from Patricia Finderstone. Ed, she wants to know if you're aware of any public health departments that are communicating with this kind of messaging that you have outlined.
Yes, and as a matter of fact, quite a number of them are identified in the communication primer. So these would be early adopter health departments who are already getting down to business back in 2010. Orange County, Florida, that would be Orlando, was clearly an innovator back then. I believe Portland, we pulled out some activities that Portland was doing. A number of health departments across California were very active then. I know that in the interim, that CDC has funded both, through NACCHO, has funded a number of county and city health departments, and through ASTO, a number of state public health departments. So I would encourage you both to look at the primer, as well as go to ASTO and NACCHO's websites to see which of the city and county and state health departments have been funded, and you can track it back through that mechanism.
Great. The next question's from Val Wangler. She says that this was profoundly helpful. What verbiage, what messaging do you suggest to address disproportionate impact on vulnerable populations?
Yeah, that's such a good question. Thank you. I'm about halfway through the Pope's encyclical on climate change, and I have to say the Pope's language is, I mean, he's speaking public health language. His encyclical, the number one message I'm taking from his encyclical is that climate change, the worst part about climate change is that the people who are contributing the least to it are being hurt the most by it, and that will continue to become increasingly so over time. And that really is the message of health disparities, that accurately portrays the way that climate change will harm the public's health. The poorest Americans, the poorest people across the planet, are already being hurt more by climate change than middle class and wealthier people and wealthier societies. And ironically, they have been contributing less to the problem because they simply use less resources. So we've got the whole health disparities issue that I think is very important to make clear. And then the other issue that's also very important to make clear is that people who are already sick, people who have a variety of chronic conditions, and people who are frail due to their age, either very young or very old, they too are most susceptible, most vulnerable to being harmed by climate change. So this is why protecting our health is not only the smart thing to do, it's the right thing to do. Those of us who can make a difference absolutely are obligated to make a difference, to protect not only ourselves and our people, but to protect all people, including the most vulnerable.
Excellent. I think we have a few folks that are asking a very similar question. They came in late or they didn't quite get some of the information. A lot of them are asking for the URL for your website, where they can download the kit, things like that. I just want to remind folks that all these slides as well as the recording will be put up on our website tomorrow. You'll also be receiving an email with the link to the webinar so that you can see it that way. But Ed, if you want to also repeat what your URL is for some folks and where they can download the kit.
Sure. The URL is climatechangecommunication.org. All one word, climatechangecommunication.org. But you can also Google my center. I'm at George Mason University, the Center for Climate Change Communication. And that will take you right to me.
Right. And with the slides being put up and then getting the link, they'll see that as well. Because of the time, I'm going to go back to the people with the hands up, and I noticed that that person left. I do not see anybody else that has their hand up. One person has just asked if this message can be altered for things like fracking or other environmental issues.
Absolutely, yes. As a matter of fact, on my to-do list, I'm hoping to work with PSR and others to tailor the message box I shared with you tonight, so that there is a version specifically related to defending the Clean Air Act, and another related version that would be optimized for defending and supporting the Clean Power Plan, and then a third version that would be optimized for supporting the need for a state power plan in your state. But the basic rationale behind simple, clear messages repeated often by a variety of trusted voices, and the basic logic of figuring out, once you figure out your message, what it is, committing it to an actionable form by putting it in a message box, that really is totally appropriate to any issue you will ever be working on.
Great. And I think for finishing up this part of the webinar, Cliff from Cockerham from Tennessee wanted you to know that, and everybody to know, that he just recently spoke to a room full of bishops from a conservative denomination and was surprised to discover that they uniformly rejected the concept of climate change and therefore the adverse impacts. So that the point being that one of the things that's most important is know who your audience is before you even start talking to them as to where they're at. Find out that information.
Right. Can I add something to that, though, just very quickly? If you do find yourself speaking to people who are in the dismissive segment and who dismiss the possibility that human-caused climate change is happening, as health professionals, you can talk to them exclusively about the point I mentioned earlier, which is, okay, well, let's talk about air pollution then. Let's talk about the ways in which the dirty fuel we burn to run our community is fouling our air and our water, and let's talk about how that's hurting our health. We don't have to spend another minute talking about climate change. I think you will all agree that we can have a really good conversation about that. And that, by the way, I learned that whole line of rhetoric from talking to members of the dismissive American segment out there in the field. They feel really strongly that even though climate change is happening, we have an obligation to move away from dirty fuel because it is fouling our air and our water, and it is threatening their children's health.
Exactly. And then the opposite side, Val wants to tell you that tomorrow she's attending a Bureau of Land Managing listening session. And should the message be different when speaking with very knowledgeable officials?
BLM folk are knowledgeable about climate change and the way it's impacting our natural resources. I have no doubt that they probably know nearly nothing about the way in which it is affecting us people, and I have no doubt that they will welcome learning what you can tell them. So no, I wouldn't suggest going. Some of the messages that I've talked about probably aren't relevant. The problem message about that dirty fuel polluting our air and our water, but instead going straight to the more specific problem of the ways in which it's harming our health and talking about specific opportunities is likely to be very useful to that conversation.
Great. Thank you so much, Ed. At this point, we're going to pivot away from the question and answers. And if Julia, if you could bring up my desktop at this time, that would be good. Thank you. So at this time, I invite Barb Gottlieb, our Director for Environment and Health, to join us. Barb will be presenting the August action for the webinar. Barb, are you there?
I certainly am. Can you hear me, Paz?
Yes, we do.
Okay, great. Yeah, this is Barb Gottlieb from the Environment and Health team at the National PSR office. First of all, I would just like to add my voice to Paz's to say thank you, Ed. Thank you so very much. This was a really great presentation, very clear, very well-based in just the kind of message testing that we all wish we had access to all the time, and I think immensely usable. So for our PSR audience, our challenge tonight is to take what we've learned from Ed and put it to work in communication with the people who are shaping our climate future. Specifically, here's our task. Members of Congress are currently not here in Washington, D.C. They're at home. They're where you probably are, in their state or in their district on recess, as they call it. And what they're doing is they're listening to their constituents to hear how you want them to vote. So that means you have the perfect opportunity to tell them how you want them to vote on climate change. Ed's messages are powerful and are useful for exactly that purpose. What he was telling us, more than 97% of climate scientists are now convinced that climate change is happening. As a professional, you, and here, as Ed was saying, take ownership of your health identity, personalized, talk about what you see in terms of the consequences for your health, for your family's health, or for your patient's health, if you're a health practitioner yourself. And as he was also saying, polluted air, polluted water, and climate change are hurting our health badly. You need to tell them how that's happening in your state, what specific impacts are happening in your state, and then what are the actions that you want us to take to protect our health and our climate. So as Paz was telling you, you'll have these slides at your fingertips tomorrow. We'll be emailing them out to you. And here's what I'd like you to do with these messages. We've all been hearing about the Iowa State Fair in the news. It's been a major soapbox for many of the presidential candidates. Well, most of us aren't in Iowa, but many of us do have state or county fairs going on. And guess what? Many politicians are there. They're pressing the flesh, they're talking to their constituents, and they are listening. If you are going to the fair, and I hope you will, seek out your local politicians and share these finely honed messages we've gotten from Ed and practice your message box approach. If you're not going to the fair, and I know that some of us aren't, your congressperson and your senators, as I said, they're in district right now. Call the district office, see if you can make an appointment, and go there and talk to them. That's the best thing you can do. And finally, if you're not able to do any of these things within the next couple of weeks, we are going to make it easy for you. Tomorrow, when we send out the link to the slides, we're also sending you an action alert, which is an email to your senators and congressperson with this message. We'd like you to send it on. We'd like you to personalize the message with your health credentials, your health concerns, and the climate impacts affecting your state, but above all, make yourself heard. So that's the action, and we hope you'll take it tomorrow. Thank you very much.
Thank you, Barb. At this point now, Catherine Thomason, Executive Director of PSR, if you could come on and do your invitation for the exciting September events. Catherine, you might probably have to unmute yourself. Catherine, are you there?
I am. Can you hear me now?
Now we can hear you, yes.
Sorry. So what I was saying is that several questions that came up on a question panel involved, how does this really impact our health? How is ozone increasing with climate change? How does this impact our water? What infectious diseases are increasing? So we are holding the Climate Health Summit in Washington, D.C., September 20th and 21st. The entire morning is devoted to climate change health impacts. And I underline Ed's message that the National Climate Assessment is a great resource to explain those connections, and with lots of wonderful graphics. The afternoon includes more in-depth communication skills, policy. What are we wanting people to do, and how can we talk about that? So we'll have experts like Ed there, along with many others, who will talk about the best ways to frame the message, time to practice the message, to learn more about the Clean Power Plan and how it's going to be implemented in the states with our support, as well as things people can do locally, and especially in urban areas. And the reason that we're putting this on, along with many co-sponsors like American Public Health Association, American Lung Association, other health groups, is because we need more health voices. The health frame, as Ed was saying, resonates with many, many Americans, and if they understand more how climate change impacts health, they're more likely to encourage action, support policy, and advocate for themselves for changes. So I encourage everyone to come September 20th and 21st. You have until Friday to get lower cost hotel rooms. You can sign up on our website, psr.org/climate summit. Thanks.
Thank you so much, Catherine. This concludes the webinar, but I'd like to, first of all, once again thank Ed for giving us his time and expertise and knowledge. You will hear more from Ed if you come to the summit. He will be presenting, so if you're interested in this subject and you want to know more, please come. Also, join us next Wednesday, September 16th, Wednesday, September 16th from 8 to 9 for the next PSR Clean Energy webinar. It is going to be on the Clean Power Plan, but is on how to ensure climate health through clean energy advocacy. we're basically going to focus on how state PSR activists are already advocating for clean energy and how you can then learn from them as to what strategies and opportunities exist to support the Clean Power Plan in your state, gain insight as to what to do, how to do it well, and how to advocate within your state. So we hope that you can join us September 16th for the webinar, September 20th, 21st for the summit. Look out tomorrow for the action alert email with also the links to the webinar and the slides. I want to thank everyone who has participated tonight. All those folks that sent in questions. If I did not get to one of your questions because it came after the Q&A, I will make sure to answer it individually. Thank you all, and have a great night.